All right. So we are going to do a quick tutorial on how to draw the intrinsic mechanism of the hand. First off, we wanted to identify the surface anatomy of the hand. Good. Can you just close your hand for me? Perfect. Just like rotate it a little bit. There we go. From here you can see where the knuckles are located. Your metacarpal phalangeal joint, PIP, and the DIP joints. So I'm going to start off by marking those joints. Go ahead and open your hand. Flatten them out. Perfect. And start marking those joints with two horizontal lines, kind of like equal signs. Okay. What you're going to need, by the way, is you're going to need a couple of pens that have different colors, that preferably permanent markers, so that they could mark directly on the glove. All right, so I'm going to start with two parallel lines that represents the MCP joint, and then we're going to go to the PIP joint right there. And then we're going to go to the DIP joint, like that. If you're feeling a little fancy, you can just connect and essentially pretend that you are seeing with an X-ray vision. So there we have it. All right. So you have the distal phalanx that I'm drawing right now, the middle phalanx, and the proximal phalanx, and then of course we have the metacarpal joint, or the metacarpal here on the second finger. All right, so Garrett, can you just like do this again for me? Just like lift your index finger up and down. Good. All right, so from there I can identify where the extensor digitorum tendon is. All right, you can just flatten your hand one more time, and we will use that as our reference point. All right. So here we have the extensor digitorum tendon coursing past the MCP joint, like so. And midway through the proximal phalanx, this tendon will trifurcate, meaning it will divide into three different parts. So you have one going into the middle, and then two on either side. Like so. Looks like chicken feet, right? So these represent our lateral bands, or part of the lateral bands, and they will continue on all the way distally, passing our middle phalanx, and then they will join together. They'll join together right at the juncture where you have your DIP joint is located. And with that, we can now form this segment right here known as the terminal tendon. All right, so right here are parts of the lateral band, right? Just creating a little bit of a thickening of the lines, like so. All right, so that is your extensor tendon turning into multiple parts. Now, we're going to also have to add the components of your intrinsic musculature. On either side of the finger are your interosseous muscles, all right? So you have your first dorsal interosseous muscle coming right about here. So this is your dorsal interosseous muscle right there. And then what it does is that it gives off a tendon that will continue all the way up. And it will give off a medial component. So we have a medial component right there, a small medial component, and then a much larger lateral component. And this lateral component will join our lateral band right there. But this medial component right here will continue and join the central slip of your extensor tendon, like that. All right, let's do the same thing on the other side. So again, we have an interosseous muscle that's palpable between the second and the third metacarpal. And it too will have a medial component, and then it also has a lateral component. This lateral component will essentially be joining the lateral bands earlier formed by your extensor digitorum in purple color. All right, so we also have our lumbrical muscle. Our lumbrical muscle is rather, it's significant, but also it's hard to kind of discern, but you will find that a little bit more on the radial aspect of the finger. So because it arises from your extensor, your flexor digitorum profundus, and then it will just continue all the way slightly distal to the insertion of your interossi, right there. So it's just going to join there, and it will also contribute to your lateral band. All right, so that is the lumbrical. So now, this is essentially what you see as most parts or components of your extensor mechanism, but there's also one more piece, a few more pieces actually, that needed to be added, and that is your sagittal bands and your transverse bands, and that completes your dorsal hood. So your sagittal bands are essentially ligamentous expansion that connects the two interossi together, right? So kind of form these bands over like so. There you go, just like that. All right, so just as a review, here again is our extensor digitorum communis tendon that goes all the way from proximal to your metacarpal joint, and then it trifurcates into a central slip, which is right here, and then your lateral bands or lateral slips, and then these lateral slips will form the lateral bands together with some of expansions from your interossi muscles, and they will essentially conjoin right around where the DIP joint is located. And then they will form, once they become together, right? They come together, they will form the terminal tendon. And then we also have your interossi muscles on the ulnar side and also on the radial side. They will give off a small medial band that will eventually connect with the central slip of your extensor digitorum, and your a lateral component that will essentially connect to the lateral band. And this connection right here will essentially continue on together with the lateral band of your extensor digitorum. The same thing repeats itself on the other side. All right, so just do this for me. There we go, extend. There you have it.